It's been 6 months since I've had bottom surgery or a vaginoplasty with a canal. And if you are someone who is just beginning the process of looking for information on your surgical transition, or you've just recently been approved for surgery, I just want to share some details about the recovery, what I've experienced, what I've enjoyed, what I haven't enjoyed, and a few second thoughts. So let's get at it. Hi, my name is Kate Madden. I live in Vancouver, BC, on the unceded territory of the Coast Salish people. I make videos for trans women in their 30s, 40s, and 50s. I try to create a resource here on YouTube that I feel I didn't have when I began the early steps towards my transition, both social, medical, and eventually surgical. And I just try to create videos that will help. And if you've found value in any of my videos and you haven't had a chance yet, please subscribe, like this video, hit that notification bell. I don't make a lot of videos, so it is something I do check in on. I read all the comments, even the shitty ones. I block those ones though, so go ahead, leave your shitty comment, but you're gonna get blocked. Something's missing. The Sauvignon Blanc from Chile. I haven't had this one yet. This is Connoisseur. I don't know. I know it's in Alberta. I know it's here in BC. I don't know where else it is. But yeah, I've tried a few of their reds, the organic ones, and so I thought I'd try the Sauvignon Blanc. So this Friday marks 6 months since my bottom surgery. Time flies, but also time has really dragged. You have no other purpose in life those first few weeks after surgery other than to focus on recovery. You're dilating 4 times a day, then it comes down to 2, and now it's down to 1 time a day. So that's 5 minutes with this one, and then 20 minutes with this one. And in one of my earlier videos, I talk about how the dots here, you can see these dots. The dots don't represent width or girth or anything like that. They're just for alignment. That's per the nurse, but I think when I read online, we all say, I can get to this dot, I can get to that dot. So I'll talk a little bit about swelling later on, but something to consider with regards to the dots. But really, what recovery taught me was you just gotta be patient, and it sucks. And there's so much you want to do. For me, it was late spring, early summer. I was with my kids, but there were things that I needed to do physically, and I would hide away from them while I took care of that. I went back to work after 7 weeks off. The surgeon, Dr. Brassard, initially gave me 12 weeks off, but I started a new job, and so that was something I did. And this did affect my energy levels for sure, because sleep, rest, nutrition, this is all super, super important stuff. So 4 times, then 2 times, now 1 time, and then at the year mark, it goes down to once a week. As well, there's notes you get these handbooks from Montreal GRS, and there's notes in there that at 3 months you can begin penetrative sex, so penis and vagina sex. And I've read that some people refer to that as organic dilation versus whatever these medical tools are made out of, some form of very hard plastic. And I'm really glad, because dilation has been, I think, just maintaining that schedule has been really the hardest part of the last 6 months for me. Just, waking up, because I've got to add an hour to my day. And if I don't get up on time, that means I'm starting my day late. but things happen, work, meetings, travel. I've gone to Toronto. I've traveled around the city. I've had all-day events, that sort of thing. I mentioned my kids. I had 4 of my kids with me at the beginning of summer. Then I had my 12-year-old in August, and then I just had my 16-year-old just left. He was with me last week. And being a parent, that's the number one job. It was a little easier with teenage boys because they sleep. But you're squeezing in the stuff you need to do around their schedule. That's kind of what I found. And recreation too, right? Like, you're going out. I saw a movie last night and I didn't dilate at all yesterday. I had an early morning meeting, and I kept saying, okay, I'll dilate in the afternoon. I'll start, 2:30, 3 o'clock. I work from home. I figured I could just kind of sneak away for a bit. And my day got away from me. I had to submit my expense report. I had to respond to some emails. And before you knew it, my brother texts me. He says, I'm here. So fortunately, it was close by. But I didn't get a chance to do the things that I needed to do. We saw Don't Worry, Darling. And it's been out for a week. And yeah, I recommend it. I'd give it 2 thumbs up. Chris Pine and Florence Pugh are worth the price of admission, even if everyone else is just kind of a bystander. And I think that's part of the point of the movie. But anyways, I digress. One thing I was really glad to stop was the sitz bath. And so that's where you fill the bathtub up, a few inches. Essentially, you're going, halfway up your genitalia. This is how it was explained to me. And then you kind of do this doggy paddle, and you're splashing you're splashing some very not very soapy, but it's warm, like lukewarm, and you've got some soap. Like, I used Ivory, non-scented, antibacterial, and you're just kind of splashing it in there. But you're dilating, and then you're douching, and then you're doing the sitz bath for 10 minutes, and that's 4 times a day. That gets so tiring. So I haven't had a bath. I've just showered the last few months since I've stopped the sitz bath. I don't want to take a bath for a while. It just reminds me of that time, and it really sucked the relaxation and enjoyment out of bathing for me. Maybe I'll repair that somehow, re-anchor myself via a nice spa somewhere or something like that. But for now, I'm done with baths for a while. Despite the monotony of the dilation, the bathing, the general cleanliness and hygiene that you need to maintain, you don't want an infection. You're essentially dealing with open wounds. Different parts heal at different times. What happens is that routine develops, this schedule develops. There's a rhythm that you just kind of fall into. And the routine is helpful, just to know that, okay, it's 7 a.m., it's 3 p.m., it's 9 p.m., whatever times you've set up, those 4 times, 3 times, 2 times, whatever. And you just do the things you got to do. Maybe those are the times I spend too much time on Reddit or Twitter, just waiting for the timer to count down. But you find things to do. I've seen people with complete setups. They put their laptop on a little riser and they're watching Netflix or Disney. Andor just came out at time of recording. And it's really cool. I just don't have the attention span to watch anything on my computer or tablet really while I'm doing that. But to that point, about seeing other people's setups, at least where I went at Montreal GRS, I had access via email to the nursing staff, and I sent them a couple of emails just like, hey, what's this? What's going on here? One time they asked me to go see my local GP, because I was concerned I had hypergranulation. I didn't. But, just having that direction was very reassuring. But also, having access to real-time advice from earlier people who had been through it, sometimes years before, sometimes weeks before, months before, or were themselves preparing to go to Montreal for surgery. And so having access to that group in social media, just to be able to ask questions like, oh my gosh, what is this? Or to see somebody else ask a question that I'm kind of wondering about as well. Also, and being able to search through all the replies and the questions and the answers. That was a tremendous, tremendous resource. So I've healed completely without any real complications at all. I still get occasional nerve pains, like the nerves reattach and there's like a zap. Sometimes it is painful. A few weeks ago, it felt like I was getting kicked in the balls, if I still had balls, but that's what it sure felt like. Like, I don't know if I still have an inguinal canal, is that what it's called? You know, where the testicles descend on either side and where the hernia slips out? If you've ever had that, I haven't, but it really felt like that pain after you've been kicked in the balls. But it passed, and, you know, it's just the occasional reminder that it's still healing. I mentioned starting the new job, and I had to go to Toronto for that at about 8 weeks in. And I didn't bring my soap with me because I figured I could just use the hotel soap to clean the dilators as well, to give myself a sitz bath in the hotel. But I think Ontario must have some sort of legislation in place regarding accessible bathrooms, because the 2 hotel rooms that I stayed in, I stayed in one by the airport and then one out in Waterloo. Both rooms, neither of them had bathtubs. They were both walk-in showers. So I'm assuming it's some sort of accessibility requirement in hotel rooms or what have you. It's the only thing I could come up with. So I didn't use the sitz bath for a week, and I used the hotel soap, you know, whatever that was, rosemary and sage or vanilla, Tahitian vanilla, whatever, you know, was left there. And I noticed after a couple days that there was a smell, very noticeable smell coming from down there. And it wasn't pleasant at all. And I was terrified my new coworkers were smelling me. I was also really nervous because it was only 7 weeks since surgery. I was also really nervous that maybe there was an infection developing or some sort of complication. Like, I took a 4.5-hour plane ride, and while I did fly back from Montreal to Vancouver just a few weeks prior, you know, I'd flown in first class. I could lay down. This flight, I got economy plus, so I had a little bit more leg room, but, you know, I was still concerned that maybe I'd pushed myself too much. At this time of the smell starting, was also the time that I stopped using sodium chloride. So you use sodium chloride for the first month or so, and you can boil it on the stove. I've got my stove right there. You can boil it on the stove with water and a teaspoon of salt, I think per 4 liters or something like that. Put it in the douche and squeeze it out. Or you can also purchase from surgical supply stores bottles of it by the liter, which is what I did for the first month. I did try making it for the first couple of weeks, but when you look at that routine that you're in, like to add another half an hour or whatever to watch the pot boil or wait for the pot to boil and cool down and transfer to a sterile container, just it was too much. I couldn't handle it. And so I went on the Facebook. I noticed the smell, had these worries, and I went onto the Facebook group and I started searching for a smell. And I wasn't the first one to experience this or to comment on it. Need a bacteriostatic lube. I was just using a travel-sized KY, which was silicone-based, not water-based. And then the second part, B, your soap needs to be antibacterial. So when you're cleaning the dilators and just washing yourself as well, you needed antibacterial soap. And Tahitian vanilla from the hotel just didn't cut it. So I was at a sales conference. My dilation schedule was really compromised that week. I was dealing with this concern, plus trying to navigate a new job, a new team, all this. And I started spotting the last 2 days as well, which was scary, but it stopped as soon as I got home and got back into my routine. Within 36 hours it stopped. And by spotting I mean like a very light pink. It was very it was negligible in terms of the quantity and the color, but my concern was I hadn't been bleeding for about 3 weeks at that point. So now, and at first you bleed a lot. I ruined my mattress. It's a biohazard now. So you bleed a lot at the start, and that was with mattress pads. And yeah, so I hadn't bled in 3 weeks, and that was the concern. It did get heavy at one point on the airplane ride back, or heavier, but I had pads, and I was fine. So I settled into the routine. I got back, settled into the new routine. My kids come, summertime, springtime, and this question kept niggling at the back of my brain. And that was, the surgery provided me, and I still experience that. I still feel a tremendous sense of peace with everything surrounding the surgery, the end results, where I am today. However, it was like I was second guessing myself. Like, was it worth it? Was all this effort worth it? I have a neo-vagina. It's never going to be the same as a natal vagina. A lot of effort, a lot of risk. Was this too much? All the things I was doing I hesitate to use the word complete myself, but it was like I was doing all this stuff to accomplish something that it was feeling very overwhelming at the time. And occasionally I still experience this sense of maybe I should have gone zero depths. As well, there's questions about sensitivity as the nerves reattach. Sometimes they don't reattach correctly, compromising sexual function. So I was like, oh my gosh, am I ever going to be able to have sex again? Can I still orgasm? This is taking a long time, but everything works. You have to massage the scar tissue. I got an ointment, a scar treatment ointment, vitamin E based ointment to help with that. So there's lines that go down the labia. It's like, and it's a little kind of knotty at the top, like it's knotted, and then it thins out down closer to the bottom of the vagina, which everything healed well. One of the things that happens post-surgery is that you stop taking your your blocker, your testosterone blocker, your anti-androgens. And so for me that was cypertarin, and your body, even without testicles, still produces some testosterone. So there was I guess a familiar sensation coming back with regards to testosterone. I noticed, kind of some of the hairs on my face were blacker. They were more coarse. I haven't gone back to electrolysis since surgery, since just before surgery. It's just been an expense I can't swing right now. But yeah, so I noticed some of the hairs on my legs and on my face were the ones that are left on my face were just blacker and thicker. But also, I'm gonna say 6 weeks, 4 weeks, 5 weeks, around there. I would get like really horny, really intensely horny, which I can only chalk up to the testosterone kind of kickstarting my libido. In that it's past, I don't have that same sense of that urgent sense of getting off. And after month 2, the recommendation from the surgeon is to begin exploring everything. And so you start to explore as well, kind of, I guess, 8 weeks, 10 weeks, something like that. Some people do it sooner, others do it later, others struggle until later. You start exploring sexually as well, like, is this thing still on, so to speak? And so, yeah, everything works, everything attached correctly for sure. There was no frustration. It didn't. While it does take longer to come to climax, it wasn't. It wasn't difficult, and it works. Everything works. What I have noticed, though, and I can only kind of chalk it up to the nerves rewiring and remapping in my brain, is the orgasm isn't as intense as it was prior, and maybe there was some nerve damage. I don't know, but it's not 100% of what it was prior, and I'll see how that goes over the next few months. I don't think that there's anything that can be done to repair that kind of situation if that's how it is, but again, my suspicion is that it's related to the nerves remapping in the brain, and it's just my brain is certainly receiving the sensory input, but it's like, how does it process? How does it compute that sensory input? And I think it's just receiving language, or it's just receiving information in a new language, if you will, and it's not fluent in that language as yet. So the swelling goes down, and at first I was like, oh my goodness, I've lost depth, because again, the dots, you're looking at that, and so what you do when you dilate is it goes in and you insert it into yourself, until you feel the back of the vaginal canal, and then you just kind of push it in there. Like, it's not hard, it's just constant pressure, and so I just use that as my marker. But I noticed, because at first I was going all the way, all the dots were obscured, and I was like, oh my gosh, one of the nurses had commented that my stent, when it came out, was really big, and so I was like, wow, I guess I have a large canal. But I think as it's kind of, I don't want to say shrunk, but I think what's happened is that a lot of the swelling post-surgery has gone down, and my surgeon told me it's going to take up to a year for the swelling to decrease to normal levels. And I think the other thing I've really noticed over the last month or so is that I started playing soccer again, and I'm exercising regularly, going to the gym. I've gained 25 pounds since surgery. Very sedentary lifestyle, just focused on dilating, not able to do a lot. And since it's fall and in Vancouver, soccer is a European season, so it's October to March. Coastal temperate rainforest, if you've watched any of my other videos. So yeah, I've started playing soccer in the Metro Women's Soccer League, and I think a lot of the running has, I don't know if stimulating is the word. I chafed once, which was not comfortable. Wasn't comfortable. Oh god. Anyways, yeah. So it works. Everything works. One of the other things, two other things I've noticed. The left side is more numb than the right side. Like there's more feeling on the right side. And again, I suspect this is just healing, swelling, but there's less sensitivity on the left side. So that's something else. Urinating is there's no real stream. Like occasionally there's a stream, but there isn't a stream. Most of the time it's just kind of goes everywhere. There's sometimes, like just having started the exercising or restarted exercising again. So there's a tendon on the penis, and again, these are surgical tools or medical devices. There's a tendon that connects the penis to the pelvis or whatever, and that gets severed during surgery, of course. And it's a thing I noticed that hurt. It hurt. It's like rolling your ankle, I guess, would be the way I would describe it. And I noticed sometimes, kind of the day after exercising, that it can be a little tender. So like reaching over the counter, doing the dishes, that sort of thing. It can just be a little tender. But it's fine. I do still occasionally notice a smell, and I just chalk that up to cleanliness essentially, and I just try to wipe correctly, so front to back. I did get a UTI 3 weeks ago. That sucked. A lot of cranberries. It felt like when I had the catheter in the hospital. Like there's the bladder spasm at the end, and it's like, but it was gone. 3 days, 4 days. And I guess why I share all this, and maybe I don't think this is TMI because you're still here. I'm sharing all this because, in short, I've been able to return to normal. I go to work, come home, I play soccer, I work out. I was at class this morning. I'm taking a history class at Simon Fraser University in addition to my business class that I'm taking there. It's normal. It's like my routine, my life. My time is spoken for. So, I don't know what the next 6 months bring. Like that'll be the next video I do, is at 6 months. And, I've got one child moving in with me in a few weeks. My 16-year-old is moving in with me, so I'll be a full-time parent again. And then my 12-year-old is moving in with me at the start of next summer to go to start high school here in Vancouver. So, we'll see how my time goes. We'll see how my energy levels are. I ended a relationship as well. And that wasn't an easy decision. So, yeah. Who knows? I have no interest in dating, but penis and vagina sex is not something I've tried. Maybe I will, maybe I won't. I don't know. It's very low on the list of things for me. So yeah, like those niggling thoughts are there. They occasionally pop up when I am frustrated. That's really all it is. I'm just frustrated with the process. I'm frustrated with, having to do it again. The same thing I did yesterday. And because I keep going back to this sense of peace. And that's never left, really, since the moment I got out of the OR 6 months ago. So, in the end, this was the right decision. Thanks for watching. Again, if you found value in this, please like, subscribe, share. And as always, here's to life.